Question 1. The investigation demonstrates a localized increase in infections caused by gram-negative bacteria exhibiting resistance to multiple classes of antibiotics, alongside a documented rise in antimicrobial prescriptions within a specific healthcare network. A preliminary review of environmental sampling from wastewater treatment facilities in the vicinity reveals the presence of genes conferring resistance. Considering the principles of public health risk assessment and the potential for widespread implications of antimicrobial resistance, which of the following approaches would best guide the subsequent public health response? Option A. Initiate a public awareness campaign about the presence of resistant genes in the environment without further epidemiological investigation to preemptively inform the public. Option B. Focus solely on the number of reported resistant infections to determine the urgency of the situation, as this is the most direct indicator of public health impact. Option C. Immediately implement a network-wide ban on all non-essential antimicrobial prescriptions to curb the observed increase in resistance, pending further investigation. Option D. Conduct a comprehensive risk assessment that integrates epidemiological data on infection rates and treatment outcomes, molecular data on resistance mechanisms, and environmental surveillance findings to quantify the burden of AMR and identify key drivers. The correct answer is D. Conduct a comprehensive risk assessment that integrates epidemiological data on infection rates and treatment outcomes, molecular data on resistance mechanisms, and environmental surveillance findings to quantify the burden of AMR and identify key drivers. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the epidemiologist to balance the immediate need for public health action with the rigorous scientific methodology necessary to accurately assess the risk posed by antimicrobial resistance (AMR). Misinterpreting the data or employing an inappropriate risk assessment framework could lead to either unnecessary public alarm and resource misallocation, or, conversely, a failure to implement timely and effective interventions, thereby exacerbating the AMR crisis. The complexity arises from the multifactorial nature of AMR, involving biological, social, and environmental determinants, and the need to communicate risk effectively to diverse stakeholders. Correct approach analysis. The correct approach, focusing on a comprehensive risk assessment that integrates surveillance data, clinical outcomes, and environmental factors, represents best professional practice. This aligns with the principles of public health surveillance and intervention, as outlined by the Centers for Disease Control and Prevention, CDC, and other relevant U.S. regulatory bodies governing preventive medicine and epidemiology. Such an approach ensures that interventions are evidence-based, targeted, and proportionate to the actual risk, thereby maximizing public health impact and resource efficiency. It also adheres to ethical obligations to protect public health while minimizing undue harm or disruption. Incorrect approaches analysis. An approach that solely relies on the number of reported resistant infections without considering the severity of illness, treatment outcomes, or the prevalence of resistance in the broader community fails to provide a complete risk picture. This could lead to overestimation or underestimation of the threat, violating the principle of proportionality in public health interventions. An approach that prioritizes immediate, broad-spectrum interventions based on anecdotal evidence or preliminary findings, without a systematic risk assessment, risks unnecessary disruption to healthcare systems and potential for further AMR development due to overuse of antimicrobials. This disregards the need for evidence-based decision-making mandated by public health guidelines. An approach that dismisses the potential public health implications due to the absence of a definitive causal link between a specific environmental factor and observed resistance, without further investigation, is a failure to proactively address emerging threats. Public health practice requires a precautionary approach when significant potential risks are identified, especially in the context of AMR. Professional reasoning. Professionals should approach such scenarios by first clearly defining the scope of the problem and the available data. They should then select a risk assessment framework that is appropriate for the specific context of AMR, considering factors such as the likelihood of exposure, the severity of potential outcomes, and the vulnerability of the population. This involves a systematic review of surveillance data, clinical literature, and relevant environmental or social determinants. Communication of findings and recommendations should be clear, transparent, and tailored to the audience, ensuring that stakeholders understand the basis for proposed interventions and the associated uncertainties. Continuous monitoring and reevaluation of the risk are crucial as new data emerge. Question 2. The monitoring system demonstrates a statistically significant positive association between average regional air pollution levels and the incidence of respiratory illnesses in children across several counties. Given this observation, which of the following represents the most appropriate next step for a preventive medicine specialist? Option A. Acknowledge the potential association, but emphasize the limitations of ecological studies in establishing causality, and recommend further investigation using individual-level data designs to confirm or refute the link. Option B. Initiate a public awareness campaign focusing on individual behavioral changes to reduce exposure to air pollution without further epidemiological investigation. Option C. Conclude that the observed association is likely due to ecological fallacy and therefore has no public health relevance, dismissing the findings. Option D. Recommend immediate implementation of stricter air quality regulations and public advisories for all affected counties, citing the observed association as definitive proof of harm. The correct answer is D. Recommend immediate implementation of stricter air quality regulations and public advisories for all affected counties, citing the observed association as definitive proof of harm. Explanation. Scenario analysis. This scenario presents a common challenge in public health surveillance where aggregate data from an ecological study suggests a potential association between an environmental exposure and a health outcome. The professional challenge lies in interpreting these findings cautiously, recognizing the inherent limitations of ecological studies, and avoiding premature conclusions or policy recommendations based solely on this type of evidence. The ABPM exam emphasizes the critical understanding of study designs and their appropriate application in preventive medicine, requiring a nuanced approach to data interpretation. Correct approach analysis. The correct approach involves acknowledging the observed association, but immediately highlighting the potential for ecological fallacy. This aligns with best professional practice by emphasizing the limitations of ecological studies, which cannot establish individual-level risk. Preventive medicine professionals are ethically and professionally bound to base recommendations on robust evidence. The ABPM curriculum stresses the importance of understanding that ecological studies can generate hypotheses, but are insufficient for causal inference at the individual level. Therefore, recommending further investigation using individual-level data designs, e.g., cohort or case control studies, is the most appropriate and scientifically sound next step, adhering to the principles of evidence-based public health. Incorrect approaches analysis. One incorrect approach is to immediately conclude a causal relationship between the exposure and the outcome. This represents a significant regulatory and ethical failure by promoting unsubstantiated claims and potentially leading to misallocation of public health resources or unnecessary public alarm. It violates the principle of scientific rigor expected of preventive medicine specialists. Another incorrect approach is to dismiss the findings entirely due to the limitations of ecological studies. While acknowledging limitations is crucial, completely disregarding a potential signal of concern is also professionally unsound. Public health professionals have a duty to investigate potential threats to population health, even if initial evidence is from a less robust study design. This approach fails to uphold the proactive and investigative nature of preventive medicine. A third incorrect approach is to propose immediate public health interventions solely based on the ecological association. This is a direct violation of evidence-based practice and can lead to ineffective or even harmful interventions. It bypasses the necessary steps of establishing causality and understanding the dose-response relationship at the individual level, which are fundamental to effective public health action. Professional reasoning. Professionals facing such a scenario should employ a systematic decision-making process. First, they must accurately identify the study design and its inherent strengths and limitations. Second, they should critically evaluate the observed association in the context of existing scientific literature and biological plausibility. Third, they must consider the implications of the findings for public health and determine the most appropriate next steps, prioritizing the generation of more definitive evidence before implementing interventions. This process ensures that public health actions are guided by sound scientific principles and ethical considerations, as expected within the regulatory framework of preventive medicine. Question 3. Performance analysis shows a statistically significant underrepresentation of a specific demographic group in a routine infectious disease surveillance program, despite population-level data indicating their presence at expected levels. The epidemiologist leading the program is aware that the data collection methods for this group rely heavily on voluntary reporting through a specific community outreach channel that has recently experienced significant staffing shortages and reduced operational hours. Which of the following actions best represents the ethically and methodologically sound approach for the epidemiologist to take? Option A. Immediately adjust the weighting of data from other demographic groups to compensate for the underrepresentation, while continuing current data collection methods. Option B. Document the observed disparity and its potential causes, and initiate a targeted investigation to understand and address the barriers to participation for the underrepresented group, while continuing to report data with appropriate caveats. Option C. Publicly acknowledge the data disparity and attribute it to potential underreporting by the specific demographic group without further investigation to encourage increased participation. Option D. Halt all data analysis and reporting until a comprehensive review of the surveillance system's design and implementation, including potential biases and barriers to participation for all groups, can be completed. The correct answer is A. Immediately adjust the weighting of data from other demographic groups to compensate for the underrepresentation, while continuing current data collection methods. Explanation. This scenario presents a classic ethical dilemma in public health surveillance, requiring a careful balance between the immediate need for accurate data and the long-term trust essential for effective disease monitoring. The challenge lies in the potential for perceived or actual bias to undermine the credibility of the surveillance system, which is a cornerstone of preventive medicine. The correct approach prioritizes transparency and rigorous methodological integrity. By acknowledging the observed disparity and initiating a systematic investigation into its causes, the epidemiologist upholds the principles of scientific objectivity and public accountability. This proactive stance, grounded in established epidemiological methods and ethical guidelines for research and public health practice, ensures that any potential biases are identified and addressed, thereby strengthening the surveillance system's validity and public confidence. This aligns with the ABPM emphasis on evidence-based practice and ethical conduct. An incorrect approach would involve ignoring the disparity or attempting to subtly adjust data without a clear methodological justification. Ignoring the disparity fails to address a potential flaw in the surveillance system, risking the dissemination of inaccurate information and eroding public trust if the issue is later discovered. Subtly adjusting data without transparent justification constitutes scientific misconduct and violates ethical principles of honesty and integrity in data reporting. Such actions undermine the scientific rigor expected of preventive medicine specialists and could lead to flawed public health interventions. Professional decision-making in such situations requires a systematic process. First, recognize and document the anomaly. Second, consult relevant methodological guidelines and ethical codes. Third, design and implement an investigation to understand the root cause. Fourth, communicate findings transparently to stakeholders. And finally, implement corrective actions based on evidence. This structured approach ensures that decisions are data-driven, ethically sound, and aligned with the overarching goal of protecting public health. Question 4. System analysis indicates that a public health agency is reviewing evidence on the effectiveness of a new vaccination strategy for a specific infectious disease. A recent systematic review and meta-analysis has been published, pooling data from 5 randomized controlled trials, RCT, and 3 observational studies. The meta-analysis reports a statistically significant pooled relative risk of 0, 75, 95% psi, 0, 60-0, 90 for disease incidence. However, the I-squared statistic for heterogeneity is 85%, indicating substantial variability between the studies. The agency's epidemiologist is tasked with advising on policy implementation. Which of the following represents the most appropriate interpretation and subsequent recommendation? Option A. Recommend immediate widespread implementation of the vaccination strategy based on the statistically significant pooled relative risk, as the confidence interval does not include 1, 0. Option B. suggests that the pooled relative risk of 0.75 is too small to be clinically meaningful, despite its statistical significance, and therefore the strategy should not be adopted. Option C. Conclude that the meta-analysis is unreliable due to the high heterogeneity and recommend relying solely on the results of the largest RCT included in the review. Option D. Advise caution and recommend further investigation into the sources of heterogeneity before making a policy decision, considering that the substantial heterogeneity may limit the generalizability of the pooled effect to the target population. Correct answer is A. Recommend immediate widespread implementation of the vaccination strategy based on the statistically significant pooled relative risk, as the confidence interval does not include 1.0. Explanation. Scenario analysis. This scenario presents a common challenge in preventive medicine where a public health official must synthesize evidence from multiple studies to inform policy. The challenge lies in the potential heterogeneity of study design, populations, and outcomes within the collected literature, which can complicate the interpretation of a meta-analysis. Misinterpreting the pooled effect size or the implications of heterogeneity can lead to ineffective or even harmful public health interventions. The official must navigate the nuances of statistical significance versus clinical significance and understand the limitations inherent in combining diverse studies. Correct approach analysis. The correct approach involves critically appraising the quality of the included studies and assessing the statistical heterogeneity among them. This aligns with the rigorous methodology expected in systematic reviews and meta-analyses, as outlined by established guidelines for evidence synthesis, which are implicitly expected for ABPM certification. Understanding heterogeneity, e.g., using I-squared statistic and Cochrane's Q-test, allows for appropriate interpretation of the pooled effect. If heterogeneity is high, it suggests that the studies are too dissimilar to combine meaningfully, and the pooled estimate may not be generalizable. In such cases, a narrative synthesis or subgroup analysis might be more appropriate than a direct interpretation of a single pooled effect. This approach prioritizes the validity and applicability of the evidence to the specific public health context. Incorrect approaches analysis. One incorrect approach is to solely focus on the p-value of the pooled effect size without considering the heterogeneity or the clinical significance. This fails to acknowledge that statistical significance does not automatically equate to clinical relevance, or that a statistically significant pooled effect might be driven by a few large, potentially biased studies, or that the pooled estimate may not be applicable to the target population if heterogeneity is substantial. This approach risks overstating the certainty of the findings and making recommendations based on potentially misleading data. Another incorrect approach is to dismiss the meta-analysis entirely due to the presence of any heterogeneity, without further investigation. While high heterogeneity can be problematic, it does not always preclude a useful meta-analysis. Exploring the sources of heterogeneity through subgroup analysis or meta-regression can reveal important insights about which populations or study characteristics lead to different effects. Discarding the pooled estimate without this deeper analysis misses an opportunity to understand the nuances of the intervention's effectiveness. A third incorrect approach is to overemphasize the findings of a single, well-conducted study within the meta-analysis, while downplaying the pooled result. While individual high-quality studies are important, the strength of a meta-analysis lies in its ability to provide a more precise and robust estimate of the effect by combining evidence from multiple sources. Ignoring the pooled result in favor of a single study, even a strong one, can lead to a less reliable conclusion. Professional reasoning. Professionals should adopt a systematic and critical approach to evidence synthesis. This involves 1. Clearly defining the research question. 2. Conducting a comprehensive and unbiased literature search. 3. Critically appraising the quality of individual studies. 4. Assessing and quantifying heterogeneity. 5. Choosing an appropriate statistical method for pooling if feasible. 6. Interpreting the pooled effect size in conjunction with heterogeneity and clinical significance. And 7. Considering the limitations of the review and the applicability of the findings to the target population. This structured process ensures that public health decisions are based on the best available evidence, minimizing the risk of error and maximizing the potential for positive health outcomes. Question 5. Process analysis reveals that a public health surveillance program has collected data on the duration of untreated illness for a specific infectious disease within a community. Initial review of the data suggests a right-skewed distribution, with several individuals reporting unusually long durations of illness. When preparing a report for the Centers for Disease Control and Prevention (CDC) regarding the typical duration of untreated illness and its variability, which combination of descriptive statistics would best represent these findings accurately and ethically, adhering to U.S. public health reporting standards? Option A, median and interquartile range ICR. Option B, mean and median. Option C, mean and standard deviation. Option D, mode and range. The correct answer is A, median and interquartile range ICR. Explanation: scenario analysis. This scenario presents a common challenge in preventive medicine where descriptive statistics are used to characterize a population's health status. The challenge lies in selecting the most appropriate measure of central tendency and dispersion to accurately represent the data, especially when the data may be skewed or contain outliers. Misrepresenting these characteristics can lead to flawed conclusions about disease prevalence, risk factors, and the effectiveness of interventions, potentially impacting public health policy and resource allocation. The ABPM exam emphasizes the practical application of epidemiological principles within the U.S. regulatory framework, requiring a nuanced understanding of how statistical measures inform public health decisions. Correct approach analysis. The correct approach involves selecting descriptive statistics that accurately reflect the distribution of the data, considering potential skewness and outliers. For a measure of central tendency, if the data is likely to be skewed, e.g., income, disease severity scores, the median is often preferred over the mean because it is less affected by extreme values. For a measure of dispersion, the interquartile range, ICR, is a robust choice when the median is used, as it describes the spread of the middle 50% of the data and is also resistant to outliers. This approach aligns with the principles of sound epidemiological practice, which prioritizes accurate data representation for informed decision-making, consistent with the spirit of public health regulations that mandate evidence-based approaches. Incorrect approaches analysis. Using the mean as the primary measure of central tendency when the data is known to be skewed or contains significant outliers is an incorrect approach. The mean can be heavily influenced by extreme values, leading to a misleading representation of the typical value in the dataset. This could result in misinterpreting the health status of the population. Similarly, relying solely on the standard deviation as a measure of dispersion when the data is skewed is problematic. The standard deviation assumes a normal distribution and is also sensitive to outliers, thus failing to provide a robust measure of variability in such cases. These approaches would violate the ethical obligation to present data accurately and could lead to noncompliance with regulatory expectations for evidence-based public health reporting. Professional reasoning. Professionals should first examine the distribution of their data. Visualizations like histograms or box plots are crucial. If the data appears skewed or has outliers, the median and IQR are generally more appropriate measures of central tendency and dispersion, respectively. If the data is normally distributed, the mean and standard deviation are suitable. The choice of statistics should always prioritize accurate and transparent communication of findings to stakeholders, ensuring that public health decisions are based on a true understanding of the data. This systematic approach ensures compliance with the expectation of rigorous scientific methodology in public health practice. Question 6. Compliance review shows that a recent epidemiological study investigating the association between a specific environmental exposure and a rare disease reported a p-value of 0.03 and a 95% confidence interval for the odds ratio of 1 to 1. 3. The study authors concluded that the exposure definitively causes the disease and recommended immediate, widespread public health interventions. Which of the following interpretations and recommended actions best reflects sound epidemiological practice and responsible public health decision-making in this context? Option A. Dismiss the findings as inconclusive because the confidence interval includes values close to 1, indicating that the association might not be strong enough to warrant concern. Option B. Conclude that the exposure is a definitive cause of the disease due to the statistically significant p-value and immediately implement broad public health interventions, as recommended by the study authors. Option C. Acknowledge the statistically significant association, but emphasize that the confidence interval suggests a modest effect size and further research is needed to confirm causality and assess the magnitude of public health impact before implementing widespread interventions. Option D. Focus solely on the lower bound of the confidence interval, 1 as evidence of a strong causal link, and proceed with implementing interventions based on this minimal observed effect. Correct answer is C. Acknowledge the statistically significant association, but emphasize that the confidence interval suggests a modest effect size, and further research is needed to confirm causality and assess the magnitude of public health impact before implementing widespread interventions. Explanation. Scenario analysis. This scenario presents a common challenge in preventive medicine, where epidemiological findings from a study need to be interpreted and communicated to stakeholders, including public health officials and potentially the public. The challenge lies in accurately translating statistical results into meaningful public health implications, ensuring that the conclusions drawn are scientifically sound and ethically responsible. Misinterpreting inferential statistics can lead to misguided public health interventions, inappropriate resource allocation, or undue public alarm. The ABPM exam emphasizes the ability to critically evaluate and apply these statistical concepts within a public health context, adhering to established scientific and ethical standards. Correct approach analysis. The correct approach involves a thorough understanding of hypothesis testing, p-values, and confidence intervals, and their application in interpreting study results. Specifically, it requires recognizing that a statistically significant finding, low p-value, does not automatically equate to clinical or public health significance. The confidence interval provides a range of plausible values for the true effect size, offering a more nuanced understanding of the precision and potential impact of the observed association. A public health professional must consider the magnitude of the effect, the consistency of findings, and the biological plausibility in conjunction with the statistical evidence to make informed recommendations. This approach aligns with the ABPM focus on evidence-based preventive medicine and the responsible application of epidemiological methods. Incorrect approaches analysis. One incorrect approach would be to solely rely on the p-value to declare a finding as important or actionable. This fails to acknowledge that a low p-value can occur with very small effect sizes, especially in large studies, and does not convey the uncertainty around the estimate. Ethically, this can lead to overstating the importance of a finding or initiating interventions based on potentially spurious associations. Another incorrect approach is to ignore the confidence interval and focus only on the point estimate, which disregards the precision of the estimate and the range of plausible effects. This can lead to overconfidence in the observed result and potentially flawed decision-making. A third incorrect approach might be to overemphasize statistical significance without considering the practical implications or the potential for bias and confounding, which are critical in epidemiological interpretation and public health action. This neglects the broader context necessary for sound preventive medicine. Professional reasoning. Professionals should approach the interpretation of inferential statistics by first considering the study design and potential biases. They should then evaluate the p-value in conjunction with the confidence interval to understand both the statistical significance and the precision of the effect estimate. The magnitude of the effect and its clinical or public health relevance must be assessed, considering the specific population and context. Finally, conclusions and recommendations should be communicated clearly, acknowledging uncertainties and limitations, and aligning with established public health guidelines and ethical principles. Question 7. Implementation of a new community-based physical activity program aimed at reducing cardiovascular disease risk factors in a sedentary adult population requires rigorous evaluation. Which of the following approaches to designing the evaluation study would best ensure the validity and reliability of the findings for informing future public health policy? Option A. Evaluate the program by measuring changes in participants' self-reported exercise frequency and comparing these changes to pre-program levels without a control group. Option B. Randomly assign participants to either the new program or a control group receiving standard care, and blind both participants and outcome assessors to group assignment. Option C. Assign participants to the program based on their geographic location within the community and compare outcomes to residents in a different, non-program area. Option D. Recruit participants who express interest in the program and compare their cardiovascular risk factor changes to those of a similar community group that did not participate. Correct answer is B. randomly assign participants to either the new program or a control group receiving standard care, and blind both participants and outcome assessors to group assignment. Explanation. Scenario analysis. This scenario presents a common challenge in preventive medicine research, where a promising intervention identified in observational studies requires rigorous evaluation through a randomized controlled trial, RCT. The challenge lies in designing an RCT that is both ethically sound and scientifically robust, ensuring that the potential benefits of the intervention outweigh the risks to participants, while also yielding valid and generalizable results. The ABPM exam emphasizes the practical application of epidemiological principles, including the design and interpretation of RCTs, within the context of public health and preventive medicine. Therefore, understanding the nuances of RCT design, particularly concerning participant selection and outcome assessment, is critical for making informed decisions in real-world public health interventions. Correct approach analysis. The correct approach prioritizes the scientific integrity of the RCT by employing a robust randomization method and blinding. Randomization is fundamental to RCTs as it minimizes selection bias and ensures that, on average, the groups being compared are similar in all respects except for the intervention being studied. This allows for a valid assessment of the intervention's causal effect. Blinding of participants, investigators, and outcome assessors is crucial for minimizing performance and detection bias, further strengthening the internal validity of the study. By ensuring that knowledge of treatment allocation does not influence participant behavior or outcome assessment, blinding enhances the objectivity of the results. This approach aligns with the principles of good clinical practice and the ethical imperative to conduct research that produces reliable evidence for public health decision-making, as expected by the ABPM. Incorrect approaches analysis. An approach that relies on convenience sampling without randomization introduces significant selection bias. Participants who self-select into a study may differ systematically from those who do not, confounding the observed effect of the intervention. This failure to control for bias undermines the internal validity of the study, rendering its findings unreliable for informing preventive strategies. Furthermore, not blinding participants and outcome assessors opens the door to performance bias, participants behaving differently based on perceived treatment, and detection bias, assessors interpreting outcomes differently based on treatment allocation, both of which can distort the true effect of the intervention. Such a design would not meet the rigorous standards expected for evidence generation in preventive medicine. Another incorrect approach involves using a non-randomized comparison group that is not contemporaneously selected or matched. This can lead to significant confounding by indication or other unmeasured factors, making it impossible to attribute observed differences solely to the intervention. The lack of randomization and appropriate control for confounding makes the study results highly susceptible to bias and unsuitable for drawing causal inferences. Finally, an approach that focuses solely on surrogate outcomes without considering clinically meaningful endpoints, especially in a preventive medicine context, can be misleading. While surrogate markers can be useful, they may not always correlate with actual health outcomes. In preventive medicine, the ultimate goal is to improve long-term health and reduce morbidity and mortality. Relying exclusively on surrogate outcomes without a clear link to these ultimate goals can lead to interventions that appear effective in trials but have little real-world impact, or worse, have unintended negative consequences. This would fail to meet the ethical and scientific standards for evidence-based preventive medicine. Professional reasoning. Professionals faced with designing or evaluating an RCT should employ a decision-making framework that begins with clearly defining the research question and the target population. This is followed by selecting the most appropriate study design to answer the question, with RCTs being the gold standard for establishing causality. Key considerations include minimizing bias through appropriate randomization techniques, blinding, and the selection of relevant and reliable outcome measures. Ethical considerations, such as informed consent and risk-benefit assessment, must be integrated throughout the design process. Finally, the analysis plan should be pre-specified to avoid data dredging and ensure that the results are interpreted within the context of the study's limitations. This systematic approach ensures that research is conducted to the highest scientific and ethical standards, producing reliable evidence for public health practice. Question 8. Market research demonstrates that a novel community-based program aimed at increasing physical activity among older adults has been implemented in several diverse neighborhoods. Preliminary data suggest variations in participation rates and reported improvements in mobility across these neighborhoods. The program's effectiveness needs to be evaluated to inform future public health policy. Given that the collected data on mobility improvements are ordinal and may not follow a normal distribution, which statistical approach would be most appropriate for comparing the effectiveness of the program across different neighborhoods? Option A. Utilize a t-test to compare the mobility improvement scores between pairs of neighborhoods, assuming the data are normally distributed and variances are equal. Option B. Apply a one-way ANOVA to compare mean mobility improvement scores, assuming that the ordinal data can be treated as interval data and that the distribution is approximately normal. Option C. Conduct a series of chi-square tests to assess differences in participation rates, but rely solely on descriptive statistics to infer mobility improvements. Option D. Employ non-parametric tests, such as the Kruskal-Wallis test, to compare mobility improvement scores across neighborhoods, as these methods do not assume a specific distribution for the data. The correct answer is D. Employ non-parametric tests, such as the Kruskal-Wallis test, to compare mobility improvement scores across neighborhoods, as these methods do not assume a specific distribution for the data. Explanation. Scenario analysis. This scenario presents a common challenge in public health surveillance, where a new intervention's effectiveness needs to be evaluated without relying on assumptions about the underlying data distribution, which is often unknown or violated in real-world epidemiological settings. The need to assess effectiveness while adhering to the rigorous standards of the ABPM Epidemiology Subspecialty exam, which emphasizes evidence-based practice and appropriate methodological selection, makes careful judgment crucial. The challenge lies in selecting a statistical method that is robust, interpretable, and defensible within the regulatory framework governing preventive medicine practice and public health interventions. Correct approach analysis. The correct approach involves utilizing non-parametric statistical methods. These methods are preferred when the assumptions of parametric tests, e.g., normality of data, homogeneity of variances, cannot be met or are not known. In the context of evaluating a public health intervention, non-parametric tests like the Wilcoxon-Rank Sum test for comparing two independent groups, or the Kruskal-Wallis test for comparing three or more independent groups, are appropriate for assessing differences in ordinal or continuous data that do not conform to a normal distribution. The Mann-Whitney-U test is another equivalent to the Wilcoxon-Rank Sum test. These methods are consistent with the ABPM emphasis on sound epidemiological methodology and the ethical obligation to use the most appropriate tools to accurately assess intervention impact, thereby ensuring evidence-based recommendations for public health policy and practice. Incorrect approach is analysis. One incorrect approach would be to force the data into parametric tests without verifying assumptions. This violates the principle of using appropriate statistical methods and can lead to erroneous conclusions about the intervention's effectiveness. If the data are not normally distributed, parametric tests may yield inaccurate p-values and confidence intervals, potentially leading to incorrect decisions about the intervention's efficacy. This failure to adhere to methodological rigor is a significant ethical and professional lapse in the context of a subspecialty exam focused on preventive medicine. Another incorrect approach would be to rely solely on descriptive statistics without inferential testing. While descriptive statistics are essential for understanding the data, they do not provide a statistically sound basis for concluding whether observed differences are due to the intervention or random chance. This approach fails to meet the inferential requirements expected in epidemiological evaluations and could lead to unsubstantiated claims about the intervention's impact, which is professionally unacceptable. A third incorrect approach would be to use a parametric test that is known to be highly sensitive to violations of its assumptions, such as a standard t-test on highly skewed data, without any attempt at data transformation or justification. This demonstrates a lack of understanding of statistical assumptions and their implications, which is a critical deficiency for a preventive medicine specialist. Professional reasoning. Professionals facing this situation should first understand the nature of their data. If assumptions for parametric tests are not met, or if the data are ordinal, non-parametric methods should be considered. The choice between specific non-parametric tests depends on the study design, e.g., independent samples, paired samples, number of groups. The decision-making process should prioritize statistical validity, interpretability of results, and alignment with the ethical and regulatory standards of public health practice. Consulting statistical resources or experts is a responsible step when uncertainty exists. Question 9. Investigation of the current burden of type 2 diabetes and its association with sedentary behavior and dietary patterns within a large urban adult population is a priority for the local public health department. The department has limited resources and a tight deadline to inform upcoming community health initiatives. Which epidemiological study design is most appropriate for this initial impact assessment? Option A. A series of randomized controlled trials to evaluate the effectiveness of different interventions for reducing sedentary behavior and improving dietary patterns in individuals with type 2 diabetes. Option B. A cross-sectional study to measure the prevalence of type 2 diabetes and assess current sedentary behavior and dietary habits in a representative sample of the urban adult population. Option C. A retrospective case control study comparing the past sedentary behavior and dietary patterns of individuals diagnosed with type 2 diabetes to those without the condition. Option D. A prospective cohort study following individuals with varying levels of sedentary behavior and dietary patterns to observe the incidence of type 2 diabetes over several years. The correct answer is B. A cross-sectional study to measure the prevalence of type 2 diabetes and assess current sedentary behavior and dietary habits in a representative sample of the urban adult population. Explanation. Scenario analysis. This scenario presents a common challenge in preventive medicine, where a public health agency needs to assess the prevalence of a chronic condition and its associated risk factors within a defined population. The professional challenge lies in selecting the most appropriate study design to efficiently and accurately gather this information, given resource constraints and the need for timely data for intervention planning. The urgency of understanding the burden of disease and identifying modifiable risk factors for targeted public health action necessitates a design that can provide a snapshot of the population's health status at a specific point in time. Correct approach analysis. The correct approach involves utilizing a cross-sectional study design. This design is best suited for measuring the prevalence of both the disease and potential risk factors simultaneously in a defined population at a single point in time. It allows for the estimation of the proportion of individuals with the condition and the proportion exposed to various risk factors, enabling the calculation of prevalence ratios. This aligns with the ABPM focus on preventive medicine by providing essential data for understanding disease burden and informing the development of population-level prevention strategies. The efficiency and relative cost-effectiveness of cross-sectional studies make them ideal for initial impact assessments and for guiding subsequent, more resource-intensive research or intervention efforts. Incorrect approach is analysis. An approach that focuses solely on retrospective case control studies would be inappropriate for an initial impact assessment of prevalence. Case control studies are designed to investigate the causes of a disease by comparing individuals with the disease cases to those without controls and looking back at past exposures. They are not efficient for estimating prevalence as they start with existing cases and do not capture the full spectrum of the population. This would fail to provide a comprehensive picture of the disease burden. An approach that prioritizes prospective cohort studies would also be inefficient and premature for an initial impact assessment. Cohort studies follow a group of individuals over time to observe the development of disease in relation to exposure. While valuable for establishing temporal relationships and incidence, they are time-consuming and expensive, making them unsuitable for a rapid assessment of prevalence and associated factors. This would delay crucial public health interventions. An approach that involves conducting a series of randomized controlled trials, RCT, would be entirely misapplied in this context. RCTs are designed to evaluate the efficacy of interventions and are not suitable for descriptive epidemiological studies like prevalence assessment. Their focus is on causality of intervention, not on describing the current health status of a population or identifying risk factors in a general sense. This would represent a significant ethical and methodological failure. Professional reasoning. Professionals should first clearly define the research question and objectives. For an impact assessment focused on prevalence and associated factors, The primary goal is to obtain a snapshot of the population's health. This leads to considering study designs that are efficient for this purpose. The ABPM emphasis on preventive medicine necessitates understanding the current burden of disease to inform public health strategies. Therefore, a design that can efficiently measure prevalence and identify potential risk factors at a single point in time is paramount. Evaluating the feasibility of different designs based on available resources, time constraints, and the need for timely data is crucial. The decision-making process should prioritize designs that directly address the research question while adhering to ethical and methodological rigor. Question 10. Quality control measures reveal that a research team has collected data on a cohort of individuals to investigate the association between daily physical activity levels, measured in MET hours, and the incidence of type 2 diabetes over a 10-year follow-up period. The primary outcome is the occurrence of a type 2 diabetes diagnosis. The team is considering using regression analysis to model this association. Which of the following statistical approaches is most appropriate for this research scenario, given the nature of the outcome and the follow-up period? Option A. Logistic regression, treating the total number of diabetes diagnoses over the 10 years as the dependent variable and average physical activity as the independent variable. Option B. Survival analysis, specifically a Cox proportional hazards model, to account for the time-to-event nature of diabetes diagnosis and potential censoring of participants. Option C. Simple linear regression, using the average physical activity level as the independent variable and a binary indicator for diabetes diagnosis as the dependent variable. Option D. Poisson regression, assuming the number of physical activity units per day follows a Poisson distribution and is associated with diabetes incidence. The correct answer is B. Survival analysis, specifically a Cox proportional hazards model, to account for the time-to-event nature of diabetes diagnosis and potential censoring of participants. Explanation. This scenario presents a common challenge in preventive medicine research, ensuring the integrity and appropriate application of statistical methods when analyzing observational data. The core difficulty lies in selecting the most suitable regression model to address the research question, while adhering to the principles of sound epidemiological practice and the specific requirements of the ABPM Epidemiology Subspecialty exam, which emphasizes understanding the theoretical underpinnings and appropriate application of these techniques. The correct approach, which involves carefully considering the nature of the outcome variable and the research question to select the most appropriate regression model, represents best professional practice. Epidemiologists are ethically and professionally obligated to use methods that accurately reflect the data and the underlying biological or health processes being studied. This ensures that conclusions drawn are valid and can inform public health interventions. The ABPM exam expects candidates to demonstrate this critical thinking and methodological rigor. An incorrect approach would be to blindly apply a single type of regression analysis without due consideration for the outcome variable's characteristics. For instance, using linear regression for a dichotomous outcome e.g., disease presence/absence, is a regulatory and ethical failure because it violates the assumptions of linear regression, leading to potentially biased estimates and invalid statistical inferences. Similarly, misinterpreting the output of a logistic regression model by treating odds ratios as relative risks without acknowledging the prevalence of the outcome is a failure to adhere to sound epidemiological principles, which are implicitly tested in this exam. Failing to consider the time-to-event aspect when analyzing data where duration is a critical factor, and instead using a standard regression model, would also be a significant methodological error, leading to an incomplete or misleading understanding of the phenomenon. Professionals should employ a decision-making framework that begins with a clear articulation of the research question and a thorough understanding of the outcome variable's measurement scale and distribution. This involves asking, is the outcome continuous, dichotomous, or time-to-event? What are the assumptions of different regression models, and do they align with the data? What are the potential confounders and effect modifiers, and how can the chosen model account for them? This systematic approach ensures that the selected statistical method is not only technically sound, but also epidemiologically appropriate and ethically defensible, leading to robust and interpretable findings. Question 11. Risk assessment procedures indicate a potential association between a novel environmental exposure and a rare but serious adverse health outcome. The research team has limited funding and time. The epidemiologist is tasked with determining the appropriate sample size for a prospective cohort study. Which of the following approaches best balances the need for statistical power to detect a potentially important association with ethical considerations regarding participant burden and resource allocation? Option A. Increase the sample size significantly beyond the calculated requirement to ensure maximum certainty of detecting any potential association, even if it means exceeding the study's budget. Option B. Conduct a power calculation based on a conservative estimate of the effect size and a standard alpha and beta level, and then critically assess the feasibility of recruiting that sample size, adjusting study design elements or objectives if necessary. Option C. Recruit a small, easily accessible sample and focus on descriptive statistics, acknowledging the limitations in detecting statistically significant associations. Option D. Proceed with the largest sample size that can be recruited within the available funding and time constraints, regardless of the calculated statistical power. The correct answer is B. Conduct a power calculation based on a conservative estimate of the effect size and a standard alpha and beta level, and then critically assess the feasibility of recruiting that sample size, adjusting study design elements or objectives if necessary. Explanation. Scenario analysis. This scenario presents a common ethical dilemma in preventive medicine research where the pursuit of scientific rigor, achieving adequate statistical power, conflicts with the ethical imperative to minimize participant burden and resource utilization. The epidemiologist must balance the need for a robust study design that can detect a true effect with the practical and ethical considerations of recruiting and following a potentially larger than necessary sample size. This requires a deep understanding of statistical principles and their application within the ethical framework governing human subjects research. Correct approach analysis. The correct approach prioritizes a thorough and transparent justification for the chosen sample size, directly linking it to the study's objectives and the desired level of statistical power. This aligns with the principles of good research practice and ethical conduct, which mandate that research be designed to answer the question posed efficiently and effectively. By explicitly stating the assumptions used in the power calculation, e.g., expected effect size, alpha, beta, variability, the epidemiologist demonstrates a commitment to scientific validity and responsible resource allocation. This approach ensures that the study is adequately powered to detect meaningful associations, thereby maximizing the potential benefit of the research while minimizing unnecessary participant exposure and costs. Adherence to ABPM guidelines would implicitly require such a well-justified approach to ensure the quality and ethical soundness of the research. Incorrect approaches analysis. One incorrect approach involves proceeding with a sample size that is clearly insufficient to achieve adequate statistical power based on preliminary estimates. This represents a failure to uphold scientific integrity, as the study would be underpowered to detect a true effect, leading to potentially misleading negative results, type Roman II error. Ethically, it exposes participants to the risks and burdens of research without a reasonable prospect of generating meaningful knowledge, thus violating the principle of beneficence and potentially justice if certain populations are disproportionately burdened. Another incorrect approach is to arbitrarily increase the sample size far beyond what is necessary for adequate power, without a clear scientific rationale. While this might seem to ensure power, it leads to inefficient use of resources and increased participant burden, which is ethically problematic. It also raises questions about the scientific rigor of the planning process, suggesting a lack of understanding of the interplay between effect size, variability, and sample size. A third incorrect approach is to ignore the statistical power calculation altogether and rely solely on convenience or available resources. This demonstrates a disregard for fundamental principles of study design and statistical inference. It risks producing a study that is either underpowered, leading to false negatives, or overpowered, leading to wasted resources and unnecessary participant burden. Failing to meet the ethical and scientific standards expected in preventive medicine research. Professional reasoning. Professionals facing this dilemma should first clearly define the primary research question and the minimum clinically or epidemiologically significant effect size they aim to detect. They should then consult relevant literature and pilot data to estimate the expected variability of the outcome measure. Using these parameters, they should perform a power calculation, considering acceptable levels of alpha, type I error, and beta, type Roman II error. The resulting sample size should be critically evaluated against practical constraints such as budget, time, and feasibility of recruitment. If the calculated sample size is unfeasible, the epidemiologist must ethically and scientifically reevaluate the study's objectives, the target effect size, or the study design itself, rather than compromising on power or participant welfare. Transparency in reporting the assumptions and calculations is paramount. Question 12. The audit findings indicate a statistically significant increase in the incidence of a specific chronic respiratory condition among residents of a particular urban neighborhood over the past 2 years. Initial descriptive data reveal a higher prevalence of this condition in this neighborhood compared to other similar urban areas. Public health officials are tasked with understanding the potential contributing factors and guiding future interventions. Which epidemiological study approach would be most appropriate as the next step to systematically investigate potential associations with environmental exposures or lifestyle factors? Option A. Conduct a case control study comparing the past exposures of individuals diagnosed with the respiratory condition to those without the condition in the same neighborhood. Option B. Implement a randomized controlled trial to test the efficacy of a new air purification system in a subset of homes. Option C. Publish a report detailing the descriptive epidemiology of the increased respiratory condition incidence. Option D. Initiate a community-wide public awareness campaign about general respiratory health. Correct answer is A. Conduct a case control study comparing the past exposures of individuals diagnosed with the respiratory condition to those without the condition in the same neighborhood. Explanation. The audit findings highlight a common challenge in public health surveillance: the need to accurately characterize disease patterns and identify potential risk factors within a defined population. This scenario requires a deep understanding of epidemiological study designs to select the most appropriate method for investigating the observed increase in a specific health outcome. The challenge lies in moving beyond simple observation to inferring potential causes or associations, while adhering to the principles of scientific rigor and ethical considerations inherent in public health research. Careful judgment is required to avoid drawing premature or unsupported conclusions, which could lead to misallocation of resources or ineffective interventions. The correct approach involves selecting a study design that allows for the systematic investigation of associations between exposures and the outcome, while minimizing bias. An analytical study design, specifically a case control or cohort study, is best suited for this purpose. These designs allow for the comparison of exposure histories between individuals with the outcome cases and those without controls, or the comparison of outcome incidents between exposed and unexposed groups over time. This systematic comparison is crucial for generating hypotheses about potential etiologic factors and is a cornerstone of evidence-based preventive medicine, aligning with the ABPM emphasis on rigorous scientific methodology. An incorrect approach would be to rely solely on descriptive epidemiology. While descriptive studies are essential for identifying trends and patterns, they do not inherently allow for the investigation of causal relationships or associations. Concluding that the observed increase is solely due to a specific factor without further analytical investigation would be a premature and potentially erroneous interpretation, failing to meet the standards of scientific inquiry expected in preventive medicine. Another incorrect approach would be to immediately implement broad public health interventions based on descriptive data alone. This lacks the evidence base required for targeted and effective interventions and could be considered an overreach without sufficient analytical support, potentially violating principles of resource stewardship and evidence-based practice. Finally, proposing an experimental study without initial descriptive and analytical phases would be premature. Experimental studies, such as randomized controlled trials, are typically used to test specific hypotheses generated from observational data and are not the initial step for characterizing an emerging health trend and exploring potential associations. Professionals should approach such situations by first utilizing descriptive epidemiology to define the magnitude, distribution, and trends of the health outcome. Subsequently, analytical epidemiological studies should be employed to investigate potential associations with hypothesized risk factors. Only after generating robust evidence from these observational studies should experimental designs be considered for testing specific interventions or causal hypotheses? This stepwise, evidence-based approach ensures that public health actions are informed, targeted, and effective, adhering to the highest professional and ethical standards. Question 13. The analysis reveals a statistically significant association between prolonged exposure to a novel industrial chemical and an increased incidence of a rare autoimmune disorder in a specific occupational cohort. While the association is robust across multiple studies, the precise biological mechanism remains largely unknown, and the chemical is not considered a sufficient cause on its own, as not all exposed individuals develop the disorder. Nor is it a necessary cause, as some individuals with the disorder report no exposure. Considering the principles of causal inference in epidemiology, which of the following represents the most appropriate approach for a preventive medicine physician to recommend public health interventions? Option A. Focus solely on the lack of sufficiency and necessity to dismiss the association as coincidental, suggesting that the observed increase in the disorder is likely due to other unmeasured confounding factors. Option B. Recommend a public awareness campaign about the chemical's potential risks, but defer any regulatory action until a clear biological mechanism is identified and the chemical is proven to be both a sufficient and necessary cause. Option C. Advocate for immediate and stringent regulatory controls on the chemical, citing the strong association and the potential for serious health consequences, while initiating further research to elucidate the biological pathway and identify potential cofactors. Option D. Conclude that causation cannot be definitively established due to the absence of a sufficient or necessary cause, and therefore recommend no immediate public health action beyond continued surveillance. The correct answer is C. Advocate for immediate and stringent regulatory controls on the chemical, citing the strong association and the potential for serious health consequences, while initiating further research to elucidate the biological pathway and identify potential cofactors. Explanation. This scenario presents a common challenge in preventive medicine, interpreting epidemiological findings to inform public health intervention, particularly when dealing with complex causal relationships. The difficulty lies in moving beyond simple association to establish causation, which is crucial for justifying resource allocation and policy decisions. The ABPM exam emphasizes the rigorous application of causal criteria and understanding the nuances of sufficient and necessary causes. The correct approach involves a systematic evaluation of the evidence against established criteria for causality, such as those proposed by Bradford Hill. This method, grounded in the principles of scientific inquiry and public health ethics, allows for a reasoned judgment about the likelihood of a causal relationship. It prioritizes the strength of association, consistency of findings, specificity, temporality, biological gradient, plausibility, coherence, experimental evidence, and analogy. Applying these criteria rigorously ensures that interventions are based on the strongest possible scientific foundation, aligning with the ethical imperative to protect public health effectively and efficiently. An incorrect approach would be to solely rely on the presence of an association without further investigation into causal criteria. This fails to acknowledge the limitations of observational studies and the potential for confounding or bias, leading to potentially misguided interventions. Ethically, this represents a failure to exercise due diligence in evidence appraisal, potentially exposing the population to unnecessary risks or failing to address a genuine threat. Another incorrect approach might be to prematurely declare a cause based on a single study or a weak association, ignoring the need for replication and corroboration. This violates the principle of scientific rigor and can lead to public distrust and misallocation of resources. A third incorrect approach could be to dismiss a potential causal link due to a lack of immediate biological plausibility, overlooking emerging scientific understanding or the possibility of novel mechanisms. This demonstrates a lack of intellectual openness and can hinder the adoption of life-saving preventive measures. Professionals should approach such situations by first identifying the exposure and outcome of interest. They should then critically appraise the available epidemiological literature, considering study design, potential biases, and effect modifiers. The next step is to systematically apply established criteria for causal inference, such as the Bradford Hill criteria, to assess the strength of evidence for a causal link. This process should be iterative, incorporating new evidence as it emerges. Finally, Decisions regarding public health interventions should be made based on a comprehensive assessment of the evidence, considering not only the likelihood of causation, but also the magnitude of the effect, the feasibility of interventions, and the potential benefits and harms. Question 14. Cost-benefit analysis shows that a prospective cohort study investigating the long-term effects of a novel occupational exposure on a specific chronic disease incidence is the most scientifically sound approach to generate robust evidence for policy development, despite its significant upfront investment and extended timeline. Which of the following best describes the epidemiologist's responsibility in presenting this study proposal? Option A. Propose an alternative, less resource-intensive study design, such as a case-control study, without fully exploring whether it can adequately address the research question regarding the temporal relationship between the exposure and disease. Option B. Emphasize the definitive nature of the findings from a cohort study, downplaying any potential limitations or challenges to ensure stakeholder buy-in and secure funding without reservation. Option C. Focus primarily on the high cost and long duration of the cohort study, suggesting that a less resource-intensive design, even if less scientifically rigorous for establishing causality, might be more practical for immediate policy recommendations. Option D. Clearly articulate the strengths of the cohort design in establishing temporality and assessing multiple outcomes, while transparently discussing the associated costs, time commitment, and potential challenges like participant attrition, along with proposed mitigation strategies. The correct answer is D. Clearly articulate the strengths of the cohort design in establishing temporality and assessing multiple outcomes, while transparently discussing the associated costs, time commitment, and potential challenges like participant attrition, along with proposed mitigation strategies. Explanation. Scenario analysis. This scenario presents a common challenge in preventive medicine, where a promising but resource-intensive epidemiological study needs to be justified to stakeholders. The challenge lies in balancing the scientific rigor and potential public health impact of a cohort study with the practical constraints of funding and feasibility. The epidemiologist must not only design a sound study, but also effectively communicate its value and limitations within the established regulatory and ethical framework of the ABPM. This requires a deep understanding of cohort study design principles, their inherent strengths and weaknesses, and how to articulate these in a way that aligns with public health priorities and resource allocation decisions. Correct approach analysis. The correct approach involves clearly articulating the strengths of a prospective cohort study in establishing temporal relationships and assessing multiple outcomes from a single exposure, while also acknowledging its limitations such as cost, time, and potential for loss to follow-up. This approach demonstrates an understanding of the ABPM emphasis on evidence-based public health interventions and the importance of selecting appropriate study designs for specific research questions. By framing the justification around the study's ability to provide robust evidence for policy or intervention development, and by transparently discussing potential challenges and mitigation strategies, the epidemiologist aligns with the principles of scientific integrity and responsible resource management expected in preventive medicine. This also reflects the ethical obligation to conduct research that is both scientifically sound and maximally beneficial to public health. Incorrect approaches analysis. An approach that overemphasizes the limitations of the cohort study without presenting a compelling case for its unique strengths would be professionally unacceptable. This would fail to adequately justify the proposed investment and could lead to the rejection of a potentially valuable study. Demonstrates a lack of strategic thinking in advocating for public health research. Another incorrect approach would be to ignore or downplay the significant resource requirements, time and cost, of a cohort study. This is professionally unacceptable as it misrepresents the feasibility of the study and can lead to unrealistic expectations and subsequent project failure, undermining trust with stakeholders and potentially diverting resources from other effective interventions. It violates the principle of transparency and responsible stewardship of public funds. Finally, an approach that proposes a less rigorous study design, e.g., a cross-sectional study, solely to reduce costs, without a clear justification that it can adequately address the research question regarding causality or temporal relationships, would be professionally unsound. This fails to meet the scientific standards expected for establishing evidence for preventive interventions and could lead to flawed conclusions, potentially resulting in ineffective or even harmful public health recommendations. It neglects the core purpose of epidemiological research in informing evidence-based practice. Professional reasoning. Professionals should approach such situations by first thoroughly understanding the research question and its public health significance. They must then select the most appropriate study design, in this case, a cohort study, and be prepared to defend its selection by clearly articulating its strengths in addressing the question. Simultaneously, they must proactively identify and address the study's limitations, including resource needs and potential biases, and propose mitigation strategies. Effective communication with stakeholders, including clear articulation of the cost-benefit analysis, the scientific rationale, and the ethical considerations, is paramount. This involves a structured approach, defining the problem, evaluating design options, assessing feasibility and resources, and transparently communicating findings and limitations. Question 15. Research into a new occupational exposure in a manufacturing plant has identified a potential link to a specific respiratory illness. A case control study was conducted, comparing workers with the illness to those without, and found an odds ratio of 3:5 for exposure. A subsequent cohort study, following exposed and unexposed workers over time, found a relative risk of 2:0 for developing the illness. Public health officials are tasked with advising the plant management on necessary interventions. Which of the following interpretations and recommendations best reflects sound epidemiological practice and regulatory guidance for public health action? Option A. The relative risk from the cohort study, being a direct measure of risk, is the most reliable indicator of the exposure's impact, suggesting that while exposure controls are advisable, the risk is moderate and may not necessitate immediate drastic measures. Option B. The odds ratio of 3:5 from the case control study should be interpreted as a 3-5-fold increased risk of developing the illness for exposed individuals, and therefore, immediate and comprehensive cessation of the exposure is recommended. Option C. The relative risk of 2:0 from the cohort study, while statistically significant, is a less compelling measure of association than the odds ratio from the case control study, and therefore, the odds ratio should be prioritized for informing intervention decisions. Option D. The odds ratio from the case control study indicates a 3-5-fold increased likelihood of exposure among those with the illness, suggesting a strong association that warrants immediate implementation of stringent exposure controls. Correct answer is D. The odds ratio from the case control study indicates a 3-5-fold increased likelihood of exposure among those with the illness, suggesting a strong association that warrants immediate implementation of stringent exposure controls. Explanation. This scenario presents a common challenge in preventive medicine, where epidemiological findings must be translated into actionable public health recommendations. The core difficulty lies in accurately interpreting and communicating the strength of association between an exposure and an outcome, particularly when dealing with different measures of association, and their implications for causality and public health intervention. The ABPM exam emphasizes the ability to critically evaluate these measures within the context of established epidemiological principles and regulatory guidelines for public health practice. The correct approach involves selecting the measure of association that best reflects the public health significance of the observed relationship and is most appropriate for informing policy and intervention strategies. In this case, understanding the difference between risk ratio and odds ratio and their respective interpretations in different study designs is crucial. Attributable risk further quantifies the potential impact of removing the exposure. The correct answer will demonstrate a nuanced understanding of these measures and their application in a real-world public health context, aligning with the ABPM focus on practical application of epidemiological knowledge. An incorrect approach might involve misinterpreting the odds ratio as a direct measure of risk in a case control study, failing to account for the limitations of this measure in estimating incidence. Another failure could be focusing solely on statistical significance without considering the magnitude of the effect and its public health relevance, or inappropriately applying a measure of association from one study design to another. Ethically, misrepresenting the strength of evidence or overstating the causal link can lead to misguided public health interventions, wasted resources, and erosion of public trust. Regulatory failures would stem from not adhering to established guidelines for reporting and interpreting epidemiological data in public health reports or policy recommendations. The professional decision-making process should involve 1. clearly identifying the study design and the appropriate measures of association for that design. 2. Critically evaluating the magnitude and statistical significance of the association. 3. Considering the potential for bias and confounding. 4. Determining the public health implications of the findings, including the potential impact of interventions. 5. Communicating the findings accurately and transparently, acknowledging limitations. Question 16. Examination of the data shows a new, highly sensitive biomarker for a specific cancer has been identified. While preliminary laboratory studies suggest this biomarker can detect the cancer at an earlier stage than current methods, large-scale clinical trials demonstrating a reduction in cancer-specific mortality or morbidity from screening with this biomarker are still ongoing and have not yet yielded conclusive results. Public Health Agency is considering recommending widespread screening for this cancer using the new biomarker. Which of the following actions best aligns with the principles of screening and early detection as practiced within the U.S. regulatory framework for preventive medicine? Option A. Recommend screening only for individuals with a strong family history of the cancer, as they represent a higher risk group where early detection might be more impactful. Pending further trial results. Option B. Recommend widespread screening with the new biomarker, emphasizing its high sensitivity and potential for early detection, while acknowledging the ongoing mortality/morbidity trials. Option C. Advocate for the immediate adoption of the new biomarker as a standard screening tool, given its technological advancement and potential to identify disease earlier than existing methods. Option D. Defer any recommendation for widespread screening until robust clinical trial data definitively demonstrates a reduction in cancer-specific mortality or morbidity attributable to screening with this biomarker. The correct answer is B. Recommend widespread screening with the new biomarker, emphasizing its high sensitivity and potential for early detection, while acknowledging the ongoing mortality/morbidity trials. Explanation. This scenario presents a professional challenge because it requires the application of screening and early detection principles within the specific regulatory framework governing preventive medicine in the United States, as overseen by the ABPM. The challenge lies in balancing the potential benefits of early detection with the ethical and regulatory considerations of implementing a screening program, particularly concerning the validity and utility of the screening test itself, and its impact on patient outcomes and healthcare resource allocation. Careful judgment is required to ensure that any screening initiative aligns with established evidence-based guidelines and public health objectives. The correct approach represents best professional practice because it prioritizes the use of a screening test that has demonstrated proven efficacy and utility in reducing morbidity and mortality for the target population. This aligns with the core principles of preventive medicine and public health, which emphasize evidence-based interventions. Specifically, the U.S. regulatory framework, including guidelines from organizations like the U.S. Preventive Services Task Force (USPS), mandates that screening programs be based on robust scientific evidence demonstrating net benefit. Implementing a screening program without such evidence risks exposing individuals to unnecessary harms, such as false positives leading to anxiety and further invasive testing, or false negatives leading to a false sense of security. Furthermore, resource allocation must be justified by demonstrable public health gains. An incorrect approach would involve implementing a screening program based on preliminary or inconclusive research. This fails to meet the rigorous evidence standards required by U.S. public health policy and professional guidelines. Such an approach could lead to the widespread use of an ineffective or even harmful screening tool, violating the ethical principle of do no harm and misallocating valuable healthcare resources. Another incorrect approach would be to prioritize a screening test solely based on its technological novelty or availability, without sufficient validation of its clinical utility and impact on health outcomes. This disregards the established regulatory and ethical imperative to ensure that preventive interventions are both safe and effective. The professional decision-making process for similar situations should involve a systematic evaluation of potential screening interventions. This includes assessing the disease burden, the availability of an effective treatment for detected disease, the characteristics of the screening test, sensitivity, specificity, predictive values, and the evidence of net benefit from screening in the target population. Professionals must consult and adhere to relevant guidelines from authoritative bodies such as the USPS and other national health organizations. They should also consider the ethical implications, including informed consent, potential harms, and equitable access to screening and follow-up care. Question 17. System analysis indicates that a retrospective cohort study investigating the association between regular consumption of a novel dietary supplement and the incidence of a specific cardiovascular condition has identified a statistically significant increased risk. However, the study population also exhibits a high prevalence of a pre-existing metabolic disorder that is known to be associated with both the consumption of this supplement and the development of cardiovascular conditions. Furthermore, preliminary subgroup analyses suggest that the strength of the association between the supplement and the cardiovascular condition might differ based on the participant's age. In light of these findings, which approach is most appropriate for a preventive medicine specialist to adopt when assessing the risk and formulating public health recommendations? Option A. Acknowledge the observed association, but emphasize the need to control for the pre-existing metabolic disorder as a potential confounder, and investigate the potential for age as an effect modifier to refine the risk assessment. Option B. Focus solely on the observed association, assuming that the study's design inherently accounts for all potential confounding factors, and proceed with general recommendations. Option C. Conclude that the dietary supplement is definitively a risk factor for the cardiovascular condition, and recommend its avoidance based on the observed association, without further adjustment. Option D. Dismiss the findings entirely due to the presence of potential confounding and effect modification, stating that no reliable conclusions can be drawn from the study. The correct answer is C. Conclude that the dietary supplement is definitively a risk factor for the cardiovascular condition and recommend its avoidance based on the observed association, without further adjustment. Explanation. Scenario analysis. This scenario presents a common challenge in preventive medicine and epidemiology, interpreting observational study findings where potential confounding and effect modification exist. The professional challenge lies in accurately assessing the relationship between an exposure, e.g., a specific lifestyle factor, and an outcome, e.g., a chronic disease, while accounting for other factors that might distort or alter this relationship. Without proper consideration of confounding and effect modification, conclusions drawn from the risk assessment could be misleading, leading to ineffective or even harmful public health recommendations. The ABPM exam emphasizes the ability to critically evaluate epidemiological data and apply appropriate methods to ensure the validity of risk assessments, which directly informs preventive strategies. Correct approach analysis. The correct approach involves a systematic evaluation of potential confounders and effect modifiers. This requires understanding the established biological plausibility and epidemiological literature, linking other variables to both the exposure and the outcome. For confounding, the goal is to isolate the independent effect of the exposure. For effect modification, the goal is to identify subgroups where the exposure-outcome relationship differs. In the context of risk assessment for preventive medicine, accurately identifying and addressing these issues is paramount to developing targeted and effective interventions. This aligns with the ABPM focus on evidence-based preventive strategies, which necessitate robust epidemiological analysis. The regulatory framework for preventive medicine, while not explicitly detailing statistical methods, mandates that public health recommendations be based on the best available scientific evidence, which inherently includes rigorous epidemiological analysis to minimize bias and accurately characterize risk. Incorrect approaches analysis. Ignoring potential confounders is a significant regulatory and ethical failure. It violates the principle of evidence-based practice by presenting a biased estimate of risk. This can lead to misallocation of public health resources and ineffective interventions, potentially harming the population by failing to address the true drivers of the outcome or by recommending interventions that are not truly beneficial. Ethically, it is a failure to provide accurate information upon which public health decisions should be made. Failing to consider effect modification, while potentially less egregious than ignoring confounding, is also a failure to provide a complete risk assessment. If the effect of the exposure varies across subgroups, failing to identify this means that preventive recommendations might be overly generalized and less effective for certain populations. This can lead to health disparities if the intervention is particularly beneficial for one subgroup, but not another, and this difference is not recognized. It represents a missed opportunity for precision in preventive medicine. Attributing the entire observed association to the exposure without considering other factors is a fundamental error in epidemiological reasoning. This approach is not supported by the scientific principles of observational studies and directly leads to biased risk estimates. It fails to meet the standard of scientific rigor expected in preventive medicine and can result in public health guidance that is scientifically unsound. Professional reasoning. Professionals should approach risk assessment by first identifying the primary exposure outcome hypothesis. Then, they must conduct a thorough literature review to identify potential confounders, variables associated with both exposure and outcome, not on the causal pathway, and potential effect modifiers, variables that change the magnitude or direction of the exposure-outcome relationship. Statistical methods appropriate for controlling confounding, e.g., stratification, regression adjustment, and for assessing effect modification, e.g., interaction terms in regression models should be employed. The decision-making process should prioritize the validity of the risk estimate and the generalizability of findings, ensuring that any preventive recommendations are based on a robust understanding of the underlying epidemiological relationships. Question 18. To address the challenge of understanding the rate at which a newly identified infectious agent is spreading within a community, and to assess the immediate impact of a public health intervention aimed at reducing new infection, which measure of disease frequency would be most appropriate for an epidemiologist to prioritize for reporting and analysis? Option A, point prevalence. Option B, cumulative incidence. Option C, incidence. Option D, prevalence. The correct answer is C, incidence. Explanation. This scenario is professionally challenging because it requires an epidemiologist to select the most appropriate measure of disease frequency for a specific public health objective, considering the nuances of incidence and prevalence and their implications for resource allocation and intervention planning. The ABPM exam emphasizes the practical application of epidemiological principles in preventive medicine, meaning understanding when to use a particular measure is as crucial as knowing its definition. The correct approach involves understanding that incidence measures the rate of new cases of a disease over a defined period, making it ideal for studying the risk of developing a disease and evaluating the effectiveness of interventions aimed at prevention. Prevalence, on the other hand, measures the proportion of existing cases in a population at a specific point in time or over a period, which is valuable for understanding the burden of disease and planning for healthcare services. Choosing incidence when prevalence is needed or vice versa can lead to misinterpretations of disease dynamics, inaccurate assessments of public health needs, and ultimately, ineffective or misdirected interventions. An incorrect approach would be to select prevalence when the goal is to assess the impact of a new preventive program on the onset of disease. Prevalence would reflect the total existing burden, including chronic cases not affected by the new program, thus masking the program's true preventive effect. Similarly, using incidence to estimate the total number of individuals needing ongoing care for a chronic condition would be inappropriate. Prevalence is the better measure for this purpose. Another incorrect approach would be to conflate the two measures, using them interchangeably without considering the specific question being asked about disease occurrence or existence. This demonstrates a fundamental misunderstanding of their distinct epidemiological roles and can lead to flawed public health recommendations. Professionals should employ a decision-making framework that begins with clearly defining the public health question or objective. This involves identifying what aspect of the disease is most relevant, the rate at which new cases are emerging incidence, or the total existing burden prevalence. Next, consider the data available and the time frame of interest. Finally, evaluate which measure best informs the intended action, whether it be disease prevention, resource allocation for ongoing care, or understanding disease etiology. This systematic approach ensures that the chosen measure of disease frequency accurately reflects the epidemiological situation and supports evidence-based public health practice, aligning with the core competencies expected of a certified preventive medicine specialist. Question 19. Analysis of a proposed study to investigate the link between long-term exposure to a specific industrial air pollutant and the incidence of a rare respiratory disease in a densely populated urban area. The research team is considering several study designs, each with potential strengths and weaknesses regarding bias, confounding, and feasibility. Given the rarity of the disease and the chronic nature of the exposure, which study design would be most appropriate for establishing a potential causal relationship, while adhering to the principles of rigorous epidemiological investigation expected in preventive medicine? Option A, a case control study, identifying individuals with the rare respiratory disease and retrospectively assessing their past exposure to the industrial pollutant. Option B, a cross-sectional study, simultaneously measuring current exposure levels and the prevalence of the respiratory disease in the urban population. Option C, a prospective cohort study, enrolling individuals from the affected urban area and following them over time to ascertain disease incidence and exposure levels. Option D, a randomized controlled trial, assigning individuals to different levels of exposure to the industrial pollutant to observe disease development. The correct answer is C, a prospective cohort study, enrolling individuals from the affected urban area and following them over time to ascertain disease incidence and exposure levels. Explanation: this scenario presents a common challenge in preventive medicine epidemiology, selecting the most appropriate study design to investigate a potential association between an environmental exposure and a health outcome, while adhering to the rigorous standards of the ABPM epidemiology subspecialty exam. The core difficulty lies in balancing the need for robust evidence with practical constraints such as feasibility, cost, and ethical considerations, all within the framework of established epidemiological principles and regulatory expectations for public health research. The correct approach involves a critical evaluation of the research question, the nature of the exposure and outcome, and the available resources to determine the design that best minimizes bias and confounding, thereby maximizing the validity of the findings. This aligns with the ABPM emphasis on the application of sound epidemiological methods to inform public health interventions and policy. An incorrect approach would be to prioritize a design that is logistically simpler but inherently prone to significant biases, such as recall bias or selection bias, without adequate justification or mitigation strategies. For instance, choosing a cross-sectional study when a longitudinal design is clearly superior for establishing temporality, or opting for a case control study without a well-defined case and control selection process, would represent a failure to adhere to best practices in study design. Such choices could lead to spurious associations, misinformed public health recommendations, and a lack of credibility for the research. Professionals must employ a systematic decision-making process that begins with a clear articulation of the research question and hypotheses. This is followed by a thorough consideration of potential biases and confounders inherent in different study designs. The feasibility, ethical implications, and resource requirements of each design are then weighed. Ultimately, the selection of a study design should be driven by its capacity to yield valid and reliable evidence that can inform preventive strategies, in accordance with the principles of scientific rigor and public health ethics. Question 20. Market research demonstrates that several statistical software packages are available for epidemiological analysis. A research team is planning a longitudinal study to investigate the association between environmental exposures and chronic disease incidence in a large, diverse population. The study involves complex survival analysis, propensity score matching, and the need to integrate data from multiple sources. The team must select a statistical software package that ensures the integrity, reproducibility, and validity of their findings for potential publication and regulatory review. Which of the following considerations is most critical when selecting the statistical software for this epidemiological research? Option A, the availability of a user-friendly graphical interface that minimizes the need for coding or scripting. Option B, the software's capacity for robust statistical analysis, its validation status, and its support for reproducible research through scriptable workflows. Option C, the cost of the software license and the vendor's reputation for customer support. Option D, the software's ability to generate visually appealing graphs and reports for immediate presentation to stakeholders. The correct answer is D, the software's ability to generate visually appealing graphs and reports for immediate presentation to stakeholders. Explanation: the scenario presents a common challenge in epidemiological research, selecting the appropriate statistical software for a study. This requires careful consideration of the software's capabilities, the study's design, the data complexity, and the need for reproducible and auditable research, all within the regulatory framework governing preventive medicine and epidemiological research in the United States. The professional challenge lies in balancing the desire for efficient analysis with the imperative to maintain scientific rigor, data integrity, and compliance with ethical and regulatory standards. The correct approach emphasizes the use of statistical software that is well documented, widely validated, and capable of handling the specific analytical needs of the study, while also supporting reproducible research practices. This aligns with the principles of good epidemiological practice and the expectations for research submitted to regulatory bodies or published in peer-reviewed journals. The ability to generate clear, reproducible code and maintain audit trails is paramount for ensuring the validity and transparency of findings, which is a core tenet of scientific integrity and a requirement for many research funding and publication standards. An incorrect approach would involve selecting software based solely on ease of use or familiarity, without assessing its suitability for the specific epidemiological questions and data types. This could lead to analytical errors, biased results, or an inability to reproduce the findings, thereby compromising the scientific validity of the research. Furthermore, using proprietary or poorly documented software without a clear understanding of its underlying algorithms can create an unverifiable black box, which is unacceptable in rigorous scientific inquiry and can raise concerns with regulatory oversight. Another incorrect approach might be to rely on software that lacks robust data management and security features, potentially leading to data breaches or integrity issues, which are serious ethical and regulatory violations. Professionals should approach this decision by first clearly defining the research objectives and the types of statistical analyses required. They should then evaluate potential software based on its documented capabilities, validation status, community support, and its ability to facilitate reproducible research through scriptable workflows and clear documentation. Consulting with experienced statisticians and epidemiologists, and reviewing relevant guidelines from professional organizations and regulatory bodies are crucial steps in making an informed and defensible choice.